Cipralex tablets जिसका chemical
Today we will discuss Cipralex, Escitalopram, uses, side effects, dosage. Cipralex, Escitalopram, is an antidepressant containing the active ingredient Escitalopram. It belongs to a class of medications called Selective Serotonin Reuptake Inhibitors, SSRIs. Cipralex, Escitalopram, is used to treat a variety of mental disorders, including No-1 depression. Cipralex helps relieve symptoms of depression. Symptoms of depression include feeling sad, loss of interest and pleasure, sleep problems, appetite changes, lack of energy, and difficulty concentrating. No-2 anxiety disorders. Cipralex also helps relieve the symptoms of anxiety disorders, like panic attacks, social anxiety disorder, generalized anxiety disorder, and post-traumatic stress disorder. Obsessive-compulsive disorder, OCD. Cipralex helps relieve symptoms of OCD. OCD symptoms include obsessive thoughts and behaviors. Postpartum depression. Cipralex helps relieve the symptoms of postpartum depression. Postpartum depression is a condition that begins after childbirth and causes a decrease in mood, energy, and concentration in women. What are the dosages of Cipralex, Escitalopram? Cipralex is usually taken once a day, morning or evening. It may take several weeks for the medication to take full effect. However, if it causes side effects such as insomnia, taking it at night may be preferable. What are the side effects of Cipralex, Escitalopram? Cipralex can cause certain side effects. Common side effects include dry mouth, insomnia, headache, nausea, and diarrhea. More serious side effects of Escitalopram include weight gain, sexual dysfunction, suicidal thoughts. How long does it take for depression medications to take effect? More serious side effects include weight gain, sexual dysfunction, and suicidal thoughts. Can Cipralex, Escitalopram, used during pregnancy and breastfeeding? Cipralex should not be used during pregnancy or breastfeeding. It should also not be used with a class of medications. It is contraindicated during pregnancy and breastfeeding. What happens if Cipralex is stopped suddenly? If Cipralex is stopped suddenly, certain side effects may occur. These include dizziness, headache, nausea, and irritability. In some cases, worsening or recurrence of symptoms of depression may also occur. Antidepressant medications can take several weeks to take full effect, but they may take longer for some people. Thanks for watching. Take care.